Good morning, everyone. My name is Tan Yun, a postgraduate student from Tunku Abdul Rahman, University of Management and Technology, Malaysia. Today, I would like to present my research study on the combination effects of pre and post-exercise sodium bicarbonate injection on muscle performance and recovery in collegiate athletes. First of all, we have been known that sodium bicarbonate have been extensively studied by a lot of researchers, either in clinical trial, commercial products, and sport performance study. But we also found that nutritional strategy of sodium bicarbonate ingestion have not been well studied to enhance athletes' performance. Because we know that collegiate athletes, especially in basketball and volleyball game, will be required to compete consecutively in a day for at least 2 matches per day. Normally, this happens for the first 2 days of the tournament. However, research also found that the mean blood lactate range was 2.4 to 6.8 millimole per liter in basketball game and 4 to 7 millimole per liter in volleyball game. Therefore, we can see that both sports are considered high-intensity intermittent sport, and between the match without sufficient of recovery may increase the risk of injuries and impede their performance for the next match. Finally, chronic and acute sodium bicarbonate ingestion will help induce sport performance through improvement of buffering capacity and reduction of metabolic acidosis. Therefore, the purpose of this study was to investigate the combined effect of pre-exercise chronic and post-exercise acute sodium bicarbonate ingestion on muscle performance and recovery among basketball and volleyball players. There were a total of 12 players, with 5 basketball players and 7 volleyball players were recruited into this study. There were no significant difference of their age, body mass, body fat percentage, and peak power output, which means that their level is about the same, but there was significant difference of their years of experience in sport participation. This study was a double-blind, randomized crossover and placebo-controlled experimental design. There were a total of 4 lab visits for the athletes, with the first one will be familiarization. The purpose for the familiarization is to familiarize the exercise testing protocol, followed by preliminary tests to identify their muscle performance level and to determine their optimal load. So the purpose for the optimal load is to identify for the experimental trial for them to do the eccentric overload exercise, which we will explain later on. So during the muscle performance test in the pre-test, the athletes were required to perform it on the K-box flywheel trainer. There were 4 different loads, which ranging from 0.01, which is S size, to 0.07 kg per meter square, which is XL size. The load was randomized selected. Example, we started with XL followed by M, L, S, or we started with M followed by S, XL, L. There were a total of 4 sets of 8 repetitions and 3 minutes of rest in between the set. All of the data was collected via the K-meter apps, and the first 2 repetitions act as the acceleration. So which means that the 6 repetitions of the data will be collected. Followed by the experimental trial 1 and 2, the procedure was the same. Upon arrival to the lab, body composition was measured prior to the muscle performance test 1. The purpose of the body composition measurement was to ensure that the athletes consume the similar nutrients intake throughout the study. However, for the muscle performance test 1 and 2, before and after the eccentric overload exercise, respectively, was similar to the pre-test protocol. After the pre-test, we identified the optimal load for each athlete for their eccentric overload exercise on K-box flywheel trainer. The purpose for the eccentric overload exercise was to induce metabolic acidosis, which simulate the same condition in basketball and volleyball game. Since they involve a lot of eccentric movement during the game, such as sprinting, jumping, and landing, therefore we applied this protocol. The protocol for eccentric overload exercise was the athlete required to perform 10 repetitions and 10 sets with 10 minutes of rest in between the set. This protocol was adopted by Collegiate et al. 2016, and the research showed increment of the inflammatory marker after 24 and 48 hours after the protocol. These are the instruments was used during the test with InBody 570 to measure the body composition prior to the test. Latex count and blood gas analyzer was to measure the blood latex and the blood gas before, during, and after the test. Similar to the myoton tensiomyography is to measure the muscle stiffness before, during, and after the test as well. So after the pre-test, the athletes were randomized selected to consume either sodium bicarbonate or placebo. There were 1 week of washout period between the experimental trial. Athletes were required to consume 0.5 gram per kg of their body weight for the chronic sodium bicarbonate injection and were required to divide into 4 times in a day between 4 hours of injection. Athletes were required to ingest it after normal or light meal to minimize the adverse effect. Besides, after the eccentric overload exercise, athletes were required to rest for 10 minutes and ingest 0.3 gram per kg of their body weight for 5 minutes. After injection of 75 minutes, athletes were required to continue for the muscle performance test too, while for the placebo injection protocol was the same with the dosage of 0.02 gram per kg of their body weight. So all of the supplement was encased in delay release capsule to reduce the adverse effect of the gut discomfort. All of the data was being analyzed through the SPSS version 26 with the descriptive statistics on the age, years of experience, and the independent t-test was on the peak power, blood gas, and perceptual response. From the results, we can see that there was no significant difference in the metabolic response, which is the blood latex between the sodium bicarbonate and placebo in each time point. But there was a significant difference in the blood gas response in blood pH after 30 minutes and 75 minutes of post-injection and after the muscle performance test too. We can clearly see that there was no difference before the injection and after the eccentric overload exercise, which means that the athletes actually induced metabolic acidosis, which also met our requirement. However, after sodium bicarbonate injection, the blood pH level increased higher than placebo group. Even after the muscle performance test 2, sodium bicarbonate group also show higher blood pH level compared to placebo group. Furthermore, for the blood bicarbonate also shows significant increase after the injection and after the muscle performance test 2 to hypothesize that in the sodium bicarbonate group adds into buffering capacity to lower down the metabolic acidosis. So which means that we should look into blood CO2. So in the blood carbon dioxide, we can also found that there was increase of the concentration after the injection and show significant difference. This is due to the acid was being metabolized to the carbon dioxide and being eliminated throughout our body that cause alkalosis. However, we also know that after eccentric exercise may cause inflammation, which in turn cause muscle stiffness. From the result, we can see that sodium bicarbonate also adds into mechanical stress recovery after injection, but there was no significant compared to placebo group. But there was no significant difference compared between these two groups on the rate of perceived exertion. However, surprisingly, we found that perceptual response on the muscle pain was lower in sodium bicarbonate group compared to the placebo group. This can be due to the reduction of the inflammation and reduction of the muscle stiffness. But there was no significant difference between these two groups. To summarize it, sodium bicarbonate adds into recovery by increasing the blood gas response and improve the buffering capacity, which in turn adds into mechanical stress recovery response and to reduce muscle pain. One of the similar study also found that there was significant improvement of the blood pH, blood bicarbonate, and blood carbon dioxide. However, research also found that the increase of the muscle stiffness is due to the inflammation of the muscle damage after eccentric exercise. But in this study show reduction of the muscle stiffness, which translate into better recovery after sodium bicarbonate ingestion. Furthermore, through this improvement in recovery, we hypothesized that there was improvement in muscle performance. From the result, we can see that there was improvement of the muscle performance in sodium bicarbonate group compared between the post-test 2 and the pre-test 1. But there was performance reduction in placebo group. This result slightly met our hypothesis as there was no significant difference in the result. So the mechanism of the improvement of the muscle performance is due to the improvement of the buffering capacity, which in turn improve the calcium ion release during the muscle contraction and ability to supply sufficient of ATP, which is the adenosine triphosphate, to meet the exercise demand. In one of the similar studies showed that there was a significant improvement in isometric peak torque and time to fatigue after 16 minutes of sodium bicarbonate ingestion. Lastly, we have been known that the different dosage of the sodium bicarbonate ingestion may bring any adverse effect to the gut, and we hypothesize that the improvement of this recovery and performance may be due to lack of this effect. So from the result, we can see that there was no gut discomfort complaint after the sodium bicarbonate ingestion, but there was slightly complaint after the chronic ingestion, which is before the test. But most complaint was in the placebo group. However, we also find that there was a slightly increase of the gut fullness complaint after the ingestion. This is probably due to the increase of the gastric and the carbon dioxide that is being stayed inside the gut that may cause the fullness. However, the mechanism to lower down the adverse effect was the strategy that is being applied from the Oliveira et al. 2017, and the researcher asked the participants to ingest the sodium bicarbonate for every 4 hours in a day, with a total of 0.5 gram per kg of the body weight, which is similar to our study. Furthermore, in another similar study also show less effect is due to the strategy of the ingestion after 10 minutes of intense exercise and ingest it for 75 minutes with the dosage of 0.3 gram per kg of the body weight. To conclude it, this study showed that there was significant improvement of the physiological response in recovery, but little improvement in the muscle performance. For the future study, I would suggest to include neuromuscular function assessment such as counter movement jump on the phosphate form, and also monitor the muscle damage biomarker, which is creatine kinase, and maybe we can implement the sport specific testing such as repeated sprint ability to assess further in details. That's all for my presentation. Thank you.